The Justice Department is appealing a judge's decision to drop the federal mask mandate for public transportation. Several airlines have embraced the ruling, telling travelers masks are optional. But the order was struck down as the U.S. is seeing an uptick in new COVID-19 cases due to the BA.2 subvariant. Dr. Celine Gounder is here with me now. She's a senior fellow and editor at large for public health at Kaiser Health News. She's also an infectious disease specialist and epidemiologist. Dr. Gounder, it's so good to see you. I was joking, I talk to you more than my husband as COVID continues. I think a lot of the discussion since this federal judge ruled that masks shouldn't be worn on public transportation is about airports, airplanes. This is also buses, Ubers. Where are we more at risk? Where are we not?
Right, so that CDC requirement mandate that you wear a mask applied to all interstate public transportation. So that would be airplanes, buses, trains. Airplanes have pretty good ventilation, especially when you're up in the air, but buses and trains don't have nearly as good a ventilation. You can imagine you're in a bus, it could be standing room only. So I would certainly continue to wear a mask while you're indoors on public transportation.
Vaccine advisors to the CDC met this week over the future of boosters. What should they take into consideration as they decide what future recommendations are?
So with respect to boosters, there are a few different things we look at. One is how old are you? What chronic medical conditions do you have? Are you immunocompromised? So what is your risk of ending up with severe disease from COVID? Secondly, in terms of the boosters, we look at how durable is the protection you get from that additional dose. And then thirdly, how is the virus mutating? So how do we stay ahead of the virus, and do new formulations of the vaccine actually help? Or is it the same protection as you would get from the currently available vaccines?
We know COVID cases are rising, particularly in the Northeast, and there's a lot of talk about the BA.2 subvariant. We haven't heard a lot of concern, it seems like, but at what point should we be concerned?
It's still early to say. In New York State, for example, we have seen over 30% increase in hospitalizations from COVID. So we are seeing an uptick, but it's still very early in this surge. And so it's hard to say, is this going to be a little surge? Is this going to be a big surge? We don't quite know yet.
The Justice Department, as we mentioned, is appealing the recent mask mandate ruling. But what impact could the initial ruling have on the next pandemic?
Well, if this stands, so if on appeal the CDC right to or powers to implement a mask mandate are not restored, we could find ourselves in another surge next fall or winter where the CDC cannot impose another mask mandate. We could find ourselves in a future pandemic where we don't have that tool at our disposal. So that's what many of us are concerned about.
With states, we've got all this going on. I think everyone's just really confused at this point. And even though some airlines are saying masks are optional, they're also saying, most of them, we still recommend you wear them. With all of this going on, with states easing restrictions, what can we do to stay safe? And in particular, for parents who have kids under 5 who can't get vaccinated yet, what should they do?
Yeah, I think this is where it's so challenging because a lot of people are moving on, but a lot of people are getting left behind. Those kids under 5, people who have immunocompromising conditions. Remember, masks do work. Those N95 or KN95, those highest quality masks will really protect you if you wear them consistently when you're on public transportation or elsewhere indoors.
Great advice. As always, Dr. Gounder, good to see you. Thank you.